The uses and benefits of PDO threads. PDO is a biocompatible, absorbable surgical suture material that has been used in medicine for decades. In aesthetics, threads are inserted under the skin to achieve two main goals: immediate mechanical lifting and long-term collagen production. Primary uses: facial lifting, elevating sagging cheeks, smoothing nasolabial folds, smile lines, and lifting jowls along the jawline. Brow lift, lifting heavy or drooping eyebrows to open up the eye area. Neck tightening, reducing mild laxity and turkey neck by tightening the skin along the jaw and neck. Skin rejuvenation and texture. Screw or barb threads can be placed in a grid pattern to stimulate massive amounts of collagen, improving crepey skin, acne scars, and fine lines on the face, décolletage, or knees. Body contouring, occasionally used for mild skin laxity on the abdomen, arms, bat wings, or buttocks.
Who does it best? Provider qualifications. Because PDO thread lifting involves inserting needles and barbed sutures deep into the facial tissues, anatomy knowledge is critical. The face is a complex map of nerves, blood vessels, and salivary glands. A poorly placed thread can cause nerve damage, asymmetry, or skin dimpling. The best providers are board-certified plastic surgeons or facial plastic surgeons. They have the deepest understanding of facial anatomy and surgical lifting techniques. Board-certified dermatologists, experts in skin laxity and non-surgical rejuvenation. Highly experienced aesthetic nurse practitioners, NPs, or physician assistants, PAs. These providers are excellent choices if they work under the direct supervision of a doctor and have undergone extensive, specialized training specifically in thread lifts, not just basic Botox or filler training.
I feel
medical
absolutely
spas,
radiant.
Med spas. Ensure the med
lift is
spa has a
subtle,
medical
but the
director,
results are
a licensed
incredible.
physician on staff who oversees the procedures. Dermatology clinics, ideal for skin-focused treatments and collagen stimulation. Plastic surgery centers, best if you are looking for a more dramatic lift using long, barbed cog threads. How long do the results last? The PDO threads themselves dissolve safely into the body within 4 to 6 months. However, the collagen your body produces in response to the threads continues to mature. Therefore, the aesthetic results typically last 12 to 18 months. Many patients do touch-up treatments with smooth monothreads every 6 months to maintain collagen levels. Is the procedure painful? Most patients report only mild discomfort. The provider will apply a strong topical numbing cream and inject a local anesthetic, like lidocaine, into the entry points. You may feel a tugging or pulling sensation during the lift, but sharp pain is rare. What is the downtime? Downtime is minimal, but you will not look perfectly normal immediately afterward. First 24 to 48 hours, expect swelling, bruising, and tenderness. 3 to 7 days, bruising fades, and you can usually return to work and social activities, often with makeup. Restrictions. You must avoid wide mouth opening, like at the dentist, extreme facial expressions, facials, and high-intensity exercise for 2 to 3 weeks to allow the threads to anchor properly. What are the risks and side effects? While generally safe, risks include bruising, swelling, and tenderness, very common. Asymmetry, one side lifting more than the other. Thread extrusion, a thread poking through the skin, which can be easily trimmed by a doctor. Infection or dimpling of the skin. Nerve injury, rare but possible if placed incorrectly. How much does it cost? Cost varies heavily based on your location, the provider's expertise, and the number of threads used. On average, a lower face and jawline lift using barbed threads ranges from $1,500 to $4,500 plus. Collagen-stimulating smooth threads are usually priced per thread, for example, $30 to $50 per thread, and a full face might require 40 to 80 threads. Who is the ideal candidate? The best candidates are typically in their late 30s to early 50s, with mild to moderate skin laxity. Not ideal for individuals with very thick, heavy skin, threads can't hold the weight, or those with severe sagging, who would be better suited for a surgical facelift. Contraindications: pregnant nursing women, people with active skin infections, or those with certain autoimmune disorders or bleeding disorders.